Granting Hope, stories of Pelotonia-funded research at The Ohio State University Comprehensive Cancer Center, James Cancer Hospital, and Solov Research Institute. Breast cancer is the most frequently diagnosed cancer among women in the United States. It's estimated that more than 330,000 people will be diagnosed with breast cancer in 2021. 10 to 15% of women diagnosed with the disease have what's called triple-negative breast cancer, or TNBC. It is more aggressive than other forms of the disease and more difficult to treat. One reason is that TNBC lacks the types of proteins that existing chemotherapy drugs target. Dr. Ziwei Hu, a surgical oncologist at the James at Ohio State, says new immunotherapy treatments offer hope for the TNBC patients, though their results are limited so far.
These are very promising and effective for some patients with TNBC, but in general, less than 20% of those patients can benefit from current immunotherapy. So we still need to develop more effective therapies for other 80% of patients with TNBC.
Dr. Hu and a team of researchers have been awarded a Pelotonia Idea Grant to further their work on new therapies for those TNBC patients who do not respond to existing treatments. They began by researching for a marker, something produced by the TNBC tumor that can be used to target its cancerous cells.
In order to find an effective therapy, we need to first identify a marker that is expressed in the majority of the cancer patients or the tumor cells from the majority of cancer patients. And very fortunately, through the teamwork, we identified a molecule called tissue factor that are expressed by up to 86% of patients with TNBC.
While the tissue factor molecule, or TF, had been discovered in previous research, it was Dr. Hu's team who determined it could play an important role in developing new TNBC treatments. In addition to providing a reliable marker for treating tumor cells, TF appears to have the added advantage of preventing the cancer from spreading to other parts of the body. The team's work also involves using immune checkpoint inhibitors, drugs that keep cancer cells from blocking the body's immune system, which then prevents immunotherapy from being effective. Clinical trials involving the checkpoint inhibitors, the TF marker, and the latest version of immunotherapy treatment that Dr. Hu previously developed will be an important part of the team's research.
Once those technologies have been translated into clinical trials for patients with breast cancer patients or TNBC, also the efficacy and the safety proven in those clinical trials, then that will really benefit patients with breast cancer, including those with TNBC.
Depending on the results of clinical trials, the research Dr. Hu's team is conducting could be a game changer for many cancer patients.
If those treatments can be proven in clinical trials for patients with TNBC, that would open a new door for lots of other cancer patients as well, like lung cancer, pancreatic cancer, gastric cancer, liver cancer, even leukemia.
Dr. Hu credits the Pelotonia Idea Grant with helping move his team's research forward.
It really makes a big difference. Like without this Pelotonia award to support our research, it's very hard to generate preliminary results to compete for federal grants, larger grants. Without those larger grants, it's difficult to make it into clinical trials.
Pelotonia and the James at Ohio State, granting hope to cancer patients and the people working for a cancer-free world.